I'm very excited to be here to speak about BioWave. It's been a great and wonderful addition to my clinical practice. So I'm happy to share my experience and talking about case studies that I've seen in my clinic in the last year or so. The first case is a 46-year-old female, said CRNA, presented to my clinic, and she had 5-year history of chronic neck and shoulder pain. At the time of presentation, she noted that she was having severe stiffness in the neck. VAS scores ranged from 7 to 10 out of 10. And she was having a difficult time at work because every time she tried to, turn at work, pain would get worse. She was also having a hard time driving to and back from work. And for the last 5 years, she had tried various things to the point where now she was feeling quite depressed about the whole situation. She had failed physical therapy. She had failed over-the-counter medications, NSAIDs, muscle relaxants. She had done some chiropractic manipulations, also tried trigger point injections. She was barely sleeping through the night, sleeping about 3 hours at a time, waking up very tired, not feeling very refreshed, taking time off work, because of severe pain. And then also importantly, from a functional standpoint, one of the things that she really enjoyed was playing golf on the weekends. She couldn't do that anymore. So at the time of seeing her, I obtained X-ray, which was normal. Her exam appeared positive for trigger points. She had really, really tight and taut, sternocleidomastoid muscle, as well as trapezius. She did have a cervical positive for set load, but Burkitt's sign was negative. I usually do that test for radiculopathy. So in terms of the treatment plan for her, I started her on a static protocol with the BioWave script for 2 weeks. Because she was also feeling a little bit down and depressed, I typically would use Cymbalta as an adjunct because it has the dual benefit of doing pain as well as mood. And so she came back after a 3-week trial of the BioWave device, and she was quite ecstatic because at this point she was telling me her depression was beginning to fade away. She actually had gone ahead and stopped using the medication. She only did it for a few weeks. Her pain scores had dropped from 10 versus 7 to barely negligible, barely present. Pain was now 2 versus 1. It's a huge drop in the VAS scores. And she was using the device every other day, once a day. I saw this patient about 6 months ago. So now, this is fast forward. She'd been using the device for about 3 months now. Occasionally, she would use it whenever she gets a flare. She's barely on any medications. Importantly, her neck disability index rating score had improved drastically. She initially, when she came in the first visit, her score was 24. And then about 3 months later, her score was now at a 4. So she'd gone from being moderately disabled by the chronic neck pain. Now she barely has any disability. And she would highly recommend this device to other patients. And then also, she's quite happy, 10 out of 10 rating for the device.